Hey guys, it's Joel from First Point Physio, and today's video is going to be about whiplash injury. So what is whiplash? Whiplash is an acceleration-deceleration injury that occurs to the neck. So it's essentially when your head goes really fast forward and then really fast backwards, such as in a motor vehicle accident. You're rear-ended or maybe even hit from the front. And this can result in soft tissue injury as well as injury to the bone as well, to the joint. Now, there are several different ways to classify whiplash in terms of how severe the pain is or how bad the effects are from the injury. And you can have a look at that classification. It's called the Quebec Task Force classification. It goes from 0 to 5. It's quite an easy way of classifying your cervical whiplash injury. In terms of prognosis, whiplash, there's been a few studies with whiplash, and there's still a bit of uncertainty regarding the course of the condition and how the symptoms vary. But some studies report an uncomplicated recovery where pain and symptoms resolve quickly. Other studies report ongoing and often debilitating pain in like a large proportion of patients who suffer whiplash injury. Personal and societal factors also have a large impact on the course of recovery, and it's important for you and us as clinicians to take this into account. For example, are you while suffering whiplash, are you also looking after a lot of children? Are you having stress at work? Things like that also play into the prognosis. So what treatments are recommended? So the most evidence-based treatments involves reassurance regarding prognosis and encouragement to stay active. So what that means is, for us as physiotherapists, we need to make sure that we tackle this problem together and in a positive manner, knowing that movement is okay, and in actually encouraging movement instead of rest and using braces and things like that. It's also really important to start exercises and progress with these exercises as well, such as low load isometric exercises. So what's not recommended? Surprisingly enough, manual therapy is actually not recommended. However, it may aid pain relief and give us an avenue to start doing exercise. For example, massage is not recommended, but it may be something that can help with pain relief, which then may allow us to start doing exercises and commence activity. So what should you avoid whilst having whiplash? It's actually highly recommended to stay away from reduction of usual activities and immobilization. So what that means is try to get back into your daily life as best as you can, and try not to take too much rest or take too much time off work or whatever it is that you're usually doing. So guys, these are a few things about whiplash that it's important to consider if you know someone who's having whiplash, or if you yourself have had it or are currently undergoing whiplash. If you'd like to know more or like an assessment, feel free to give us a call on 81230987. Thank you. Take it easy, guys.